Hello, I'm Ann Lawrence. I'm a retired physician, psychotherapist, and sex researcher. And today I have the pleasure of speaking with Dr. James Morandini, clinical psychologist and the director of the King Street Psychology Clinic in Sydney, Australia. And our topic today is autogynephilia, an unusual sexual orientation that we sometimes see in persons with gender dysphoria or gender identity issues. Dr. Morandini is an expert in these areas, and he will be discussing autogynephilia and its importance in the assessment and treatment of clients with these gender issues. We're going to try to limit our discussion today to about 45 minutes. So one of my jobs will be an unofficial timekeeper. I may cut in at certain points to keep us on schedule, but this is really James's opportunity to share his extensive knowledge with you. I'll try to keep in the background. So to begin with, James, can you explain what autogynephilia is and why clinicians who see clients with gender dysphoria should know about it?
Certainly, Anne, and I just want to say it's an honor to be doing this interview with you. So autogynephilia literally translates to love of oneself as a woman. It's a sexual orientation that occurs only in birth-assigned males, where sexual and romantic feelings about women are directed partially or completely towards the self. And this type of attraction can coexist with typical attraction to women in the world. And in other cases, it can almost be exclusive, the focus on the self. These feelings tend to become subjectively evident to clients around puberty, but sometimes before. And they can often be confusing when they first arise. For instance, a teenage male might become aware that he has strong sexual feelings and erections when he imagines himself with a female body. You might wonder if this makes him gay or bisexual or even transgender. And why should clinicians who work with clients with gender concerns be aware of it? Well, first of all, this type of gender dysphoria that's associated with autogynephilia is quite common. And we know that a good proportion of trans women in Western countries seem to have a desire to socially and medically transition, as well as the internal feelings of yearning and distress at not being able to exist in the female role or in a female body. And this type of gender dysphoria is intimately connected to autogynephilia.
Okay, so what you're sharing with us is that this concept is important in understanding what's probably the most prevalent kind of gender dysphoria in Western birth-assigned males. And it has a lot of clinical implications, which we'll be talking about in a moment. James, the term autogynephilia describes both an erotic preference and also a sexual orientation. Could you explain what this means and why it's an important concept with clinical implications?
Yeah, certainly. Autogynephilia has all of the features of male sexual orientation. And that is, it tends to become subjectively apparent at puberty, at sexual maturation. It's stable, like all male sexual orientations. It doesn't go away. It seems to be determined prenatally. And as you've written about beautifully, Anne, it involves both sexual and romantic components. And that means that individuals with autogynephilia aren't just sexually aroused by the idea of being a woman or having a woman's body or having women's clothes. They also idealize women and become strongly identified and bonded to their feminine personas. And I think this is a point of confusion for many clinicians and also for trans people themselves, who might be aware that they experience a suite of emotional experiences that aren't explicitly sexual and which are powerful motivators for wishing to exist in the feminine role and for their social and medical transition.
So, just to briefly summarize, this is not just an erotic phenomenon, but it encompasses all the aspects of what we consider sexual orientation, everything we mean about love, broadly construed. And as you pointed out earlier, this, like other sexual orientations, is immutable. It doesn't change, it won't go away. It's something that clients will be dealing with for a long time. So in that respect, it's extremely important.
And
Um,
for those of you who are listening in, if you want to read more about that particular conceptualization of autogynephilia as involving not just an erotic component, but a romantic component, including love feelings and feelings of bonding, you could read Anne's paper on this, Becoming What We Love, Autogynephilic Transsexualism Conceptualized as an Expression of Romantic Love.
James, you do me too much honor. Uh, I'd like you to address this question. What are the different manifestations of autogynephilia, and how often do you see them in your clinical practice as presenting concerns?
Yeah, autogynephilia has been known since Blanchard's seminal writings on the topic to take a number of forms. And these forms are often co-occurring, but some can be more prominent than other within an individual. Perhaps the most common type is transvestic autogynephilia. And this is where the sexual feelings and romantic feelings are attached to presenting in women's clothing. But there are also other subtypes. One very important subtype of autogynephilia is anatomic autogynephilia. And this is where arousal and yearning is connected to having anatomic features of female bodies, breasts, vaginas, feminine soft skin and curves. This particular subtype of autogynephilia has been shown, at least in one study, to most strongly predict eventual movement towards medical transition. So it seems to be an important subtype. But there's others as well. Behavioral autogynephilia, which is arousal at moving, walking, comporting oneself in a feminine way. An example might be, an adolescent boy putting on high heels and walking, swaying his hips like a woman. Physiologic autogynephilia, which is arousal at the physical functions of female bodies that can involve menstruation, could involve being pregnant, and interpersonal autogynephilia, which is having other people see you as and interact with you as a woman, including in a sexual environment.
So these 4 or 5 types of autogynephilia that you've described, they were originally set forth by psychologist Ray Blanchard. They're complicated, but they essentially describe almost any aspect of female anatomy, physiology, behavior. Almost any aspect of being female can be eroticized by males who experience autogynephilia and can become an important component of identity in these individuals as well.
Yeah,
Uh,
and you mentioned before, right, and I'm sorry I didn't respond. You mentioned before, do these particular subtypes sometimes present clinically as presenting concerns? And I think one would be related to transvestic AGP. So, for instance, client's partner may have found a stash of clothing, which is clothing that they use to dress up as a woman, and experience fantasies related to being a woman or having a woman's appearance. And so that might lead the client to come to clinic for help with how to manage this kind of outing of sorts. Another might be a client who's presenting more for help with gender dysphoria, whose distress is more around anatomic gender dysphoria or anatomic autogynephilia. And they might come in confused because on the one hand, they do and have derived sexual arousal at the fantasy of having a woman's body, but that doesn't seem to fit neatly into the concept of transvestic fetishism that they may have read about. And in fact, they would also like to medically and socially transition and do experience clinically significant distress related to their body not aligning with what it is that they would like, which is a woman's body. And so that's the point where the anatomic autogynephilia would be the presenting case and would be these clients would be presenting for help often with a medical transition.
Do we know how common autogynephilia is, how prevalent it is in the population of birth-assigned males?
But we don't have a lot of data on prevalence. One prevalence study found a prevalence of 3% in birth-assigned males. Now, that was 3% who had ever engaged in cross-dressing with sexual arousal. What proportion of autogynephilic males experience clinically significant autogynephilia, that is, might come to a clinic because of gender dysphoria growing out of their autogynephilia, we're not sure. But around as prevalent as male homosexuality is one estimate.
Wow. So in the clients you see in your clinic, are about 3% of them individuals that you believe experience an autogynephilic orientation? Or is it more than that?
It's many more than that. Yeah. So at King Street Psychology Clinic, we specialize in gender identity concerns and sexuality. And it would be the vast majority of birth-assigned males who are coming in with gender concerns, or trans women who are wanting therapy, who are of this autogynephilic pathway. And I would put the figure at 90% plus. And I believe that corresponds
Oh,
with, roughly corresponds with some of the data that you have identified, where you found a figure about 80% of trans women in Western countries seem to be of the autogynephilic pathway.
so what you're telling us is if you work with gender minority clients with gender identity issues, gender dysphoria, you're not only going to see this occasionally, you're going to see it a lot. It's going to be a big deal in your clinical population. So autogynephilia is something that it behooves you to know about it if you're going to be a good therapist.
And I actually think that you touch upon an important reason that some clinicians might not be aware of the concept, which is the lack of contrast. That is, many clinicians might have caseloads of trans women which are almost entirely autogynephilic, and so they don't have that counterpoint of the early gender non-conforming male attracted pathway to compare it against, and then to see the distinct symptoms and struggles associated with this type.
Okay. Um, we'll get into some of those implications later on. Um, how do you decide whether a client has an autogynephilic sexual orientation? Uh, what do you look for to help you make that assessment?
The Canadian sexologist Ray Blanchard, who first kind of formalized the two-type topology, which is the notion that trans women exist in two main pathways, one being extremely feminine from an early age, birth-assigned males who are exclusively male attracted, and the other being autogynephilic males. Um, so sexual orientation is critical to identifying whether a client who's coming in with gender concerns might be autogynephilic. If the client is not exclusively or near exclusively attracted to men, it's likely that that client is autogynephilic. Now, that can sound shocking or unbelievable to many clinicians who are not used to working with constructs in psychology that are so discrete in nature. But sexual orientation in birth-assigned male is an outlier in the sense that it is quite discrete. And so it's in this and few other areas of psychology that you might see quite a discrete topology. But sexual orientation would be the main way that would identify this pathway. The next information that would be very important would be history of gender nonconformity. Autogynephilic gender dysphoria is not typically associated with marked and consistent gender nonconformity in childhood, whereas androphilic or the other type of gender nonconformity is.
So when you're trying to decide whether a client has an autogynephilic orientation, the things you look for are exclusive androphilia, exclusive attraction to males, and that's usually associated with a history of childhood gender nonconformity. So Blanchard thought if you're not exclusively androphilic, if you're not exclusively attracted to men, then you're very probably in some, maybe to say almost always going to be autogynephilic. Do you think that's really true, at least to a first approximation?
Again, I am anticipating how people listening might find it hard to believe. And certainly when I first heard about this, I found it hard to believe. I think there's some additional pieces of information that might be important to consider when thinking about whether or not it really could be the case that things are split up so neatly. The first is that male sexual orientation has always been known to represent a kind of a bimodal distribution, with most people being female attracted, very few males showing both male and female attraction, and then a smaller peak showing male exclusive attraction. I think the other piece of information that's important and which can be wrong footing is that many trans women will identify as bisexual and asexual, and for good reason, as we might go on and talk about later. And they might seem at a superficial level, therefore, not to fit onto this continuum of, or into this topology of female attracted versus male attracted. But what we know is that bisexual identities and bisexual type attractions are very common amongst autogynephilic trans women and autogynephilic males. And that's because for some of these folks, what is more prominent than their attraction to people in the world is their own embodiment. And they might say, well, I'm attracted to the idea of being a woman, as well as engaging in sex as a woman, and that includes with men. And therefore, I don't feel that I am, only attracted to women, because I can find the idea of having sex with men quite arousing. And so I call myself bisexual. But in this case, this group of bisexuals, as Ray Blanchard, was able to discern in the late 80s, have a lot to do with the autogynephilic group. Their bisexuality is mediated via autogynephilia. And the asexual group, as you might reflect upon what I said earlier on, typically individuals who might have a full inversion of their sexual interests on the self, such that they don't have interest directed out into the world.
So the issue of sexual orientation in persons with an autogynephilic orientation is complicated. There's we can think about a kind of obvious or superficial binary that helps us make a judgment, a clinical judgment about the presence of autogynephilia. But if we look at the way people talk about it, think about their own sexual orientation, things get much trickier. What clients say about their orientation may not be terribly useful to clinicians when they're trying to make this decision. They have to rely on their own judgment about what they know about clients with different kinds of sexual orientations and what they see in the client that's sitting before them.
Exactly.
So why is it important to decide whether a client with gender dysphoria has an autogynephilic orientation? How does that affect your case conceptualization, how you proceed with your assessment and treatment?
I think that's a really, really important point. And I'm aware that some resistance to utilizing the concept of autogynephilia in therapy with trans people relates to the perception that it might not be clinically useful. And my experience is that, and my belief is that it is a really useful concept in clinical work, and certainly I wouldn't be able to do much of the work I do without it. I think the first way in which it benefits clinicians in a broad sense is by assisting with the development of empathy, understanding the characteristic struggles of autogynephilic birth-assigned males, be they living in the male role or transitioned, is hard if one doesn't understand autogynephilia, the types of social traumas related to it, the types of shame that can be related to it, and the particular types of struggles with identity and sense of self that are related to it. I know, Anne, you have written about autogynephilia being a particularly difficult predicament, given that it is an experience which, although very powerful, is hidden from the view of others until one perhaps transitions, in which case the client hasn't had that very important experience mirrored by other people. It's a secret that's hidden and often shrouded in shame. And the clinician could then just be another person who conspires with the shame and conspires to deny or invalidate that part of the person. So I think it's really important from building empathy, understanding the types of struggles a client has, being able to mirror back to them their experiences. It's also useful with prognosis. We know that we start with pediatric patients, the stability and the prognosis of gender dysphoria in androphilic and trans girls who come to see themselves as girls in childhood is much less stable and tends to desist by the time the young person reaches adolescence or soon thereafter. And this group often go on to live as feminine gay men.
Mhm.
The autogynephilic pathway tends to be more progressive in nature. That is, it doesn't tend to burn out across adolescence in the same way that it does, or for which we have evidence for it doing, with that early onset androphilic type of gender dysphoria. So I think it can be useful as a clinician in understanding the likely course, communicating that with parents, and recommending appropriate interventions, including potentially medical interventions for the young person. I think another way in which it can be useful is comprehension of the young person's struggle by parents or partners where appropriate. Going back to the failure of mirroring that is experienced by many autogynephilic individuals, including autogynephilic trans women. Often parents have no idea that this has been an experience that their child has been struggling with since early adolescence. As far as they're concerned, the first they heard of it was when their child at, say, age 16 came out, said, "I'm a girl and I want to start medical transition." Without the concept of autogynephilia, their disclosure is very hard to understand and make sense of, partly because the child will not fit the classical model of trans femininity that the parents might have in mind, which is that of an exceptionally feminine little boy whose femininity is so great from childhood onwards that he makes more sense living as a woman. This will often be instead a gender conforming boy who perhaps excelled in male typical pursuits and hobbies, and whose gender issues are a mystery without this knowledge of this pathway.
You've emphasized that autogynephilia often comes to clinical attention. Um, around the time of puberty. Do we have any evidence that autogynephilia is observable before puberty?
We do, Anne, and this is why the terminology of early onset versus late onset gender dysphoria is imprecise and problematic and doesn't resonate with some autogynephilic trans women. There are published case studies of young children with autogynephilic behaviors. Um, and it's not uncommon to have clients who will disclose that they first experienced their intermittent autogynephilic fantasies as young children. They may have, for instance, dressed up in their sister's clothing and found it arousing, or brought up strong positive emotions. Um, and so in retrospect, such people might be able to draw quite a bit of continuity from their earliest memories through to adulthood. Typically, however, the autogynephilia will become more prominent and powerful and frequent at the onset of puberty.
So what you're saying is that autogynephilia is really an early onset. It can be a childhood onset phenomenon, just like the kind of gender variant expression that we see in exclusively androphilic males. Um, so that emphasizes that an attention to age of onset can be quite relevant, but this is really a typology that focuses on sexual orientation. That's the basis of the understanding. And until quite recently, that's what the DSM talked about in terms of a typology of subtypes. Before we move on, I'd just like to underline one other thing that you said. For you, as a working clinician, the concept of autogynephilia is not just useful, to use your word, it is essential. You can't do your job in a professional way, in an empathetic way, without keeping this model in mind. And I think
Yeah,
that's
that's
an
true. And I don't think it's an overstatement to say that.
okay. We are doing very well with our self-imposed time limit. So let's now talk about coexisting mental health concerns. What other issues uh, tend to come up in persons with an autogynephilic sexual orientation?
Mm. Um, the most common comorbidity that we see in our clinic is autism spectrum disorders. And of those young people at our clinic under the age of 18 who uh, meet um, that autogynephilic pathway, would be 30 or 40% also have autism spectrum disorders.
Wow, 30 or 40% of the birth assigned males that you see with gender dysphoria have an autism spectrum disorder or condition. I
Yeah,
don't think it's ever been reported in the literature, and it's fascinating that you see that so frequently.
yes, yeah, you're right,
What do
Anne.
you make?
Well, the first thing I would say is, obviously we see that amongst gender diverse populations, there's heightened rates of autism. Um, and so, but what you're saying is, it's not the case that studies have specifically looked at autogynephilic individuals and found this very heightened rate of ASD. And what do we make of it? I mean, nobody knows how these concepts are causally related. One view would be that autism and autogynephilia are not causally linked, they're orthogonal, but we have a high rate of autistic people in our clinic because people with autism tend to experience a higher rate of mental health issues of all types. And so perhaps they also are overrepresented in the autogynephilic trans people that we see at our clinic. Another view would be that our clinic is somewhat representative of the broader autogynephilic population, and that there is this heightened rate of autism spectrum disorders amongst autogynephiles, and that there might be a causal linkage between the two. Maybe there's something about autistic male brains that makes them particularly susceptible to or likely to manifest autogynephilic sexual feelings.
That's fascinating, and it sounds like a very complicated set of possibilities that we're dealing with. We don't really know that much about it at this point. It may be
It
that there's
is. Yep.
autism spectrum disorders that predispose to gender identity concerns, or it may just be that there's more ascertainment because persons with gender identity concerns tend to present for assessment, and you discover these other aspects of personality, of mental health at the same time.
Yes,
Fascinating.
exactly.
Fascinating.
And I should just jump in and say one further possible path that has been suggested, which is that, perhaps there's features of autism which would make autogynephilia become more prominent or distressing for an individual. So we know that, folks with autism can sometimes have traits like obsessionality or rigidity or black and white thinking. And so perhaps, in these individuals, the autism kind of focuses that attentional spotlight on the autogynephilia in a way that makes it more distressing and more prominent and makes transition more necessary.
Complicated situation.
Mm.
Sounds like, if you can summarize, if you see young natal male clients with autogynephilia, you should probably be alert to the possibility of an autism spectrum disorder.
Yeah.
Or if you see young males with an autistic spectrum disorder, perhaps you should be attentive to the possibility of coexisting autogynephilia or a gender identity concern. Would that be too strong?
That would be completely accurate. And yeah, as you said, sometimes it is that clients come in where the ASD is more prominent, and then autogynephilia becomes observed later on. Other times, more often at my clinic, it is that the clients come in with gender concerns, and then autism is discovered. I should just say, you did ask about other types of mental health comorbidities, and I think depression and anxiety are very common amongst our client group. I'd say it would be, again, I don't want to put a figure on it, but it would feel like it would be a good proportion who are distressed in other ways, and that anxiety can be, I think, linked to the autism in times, and we know that ASD and OCD often co-occur, and so OCD in our clients is not uncommon, as are other types of anxiety experiences.
OCD is obsessive compulsive.
Yes. Yeah.
And how about access to conditions? Personality disorders is what we call them. Uh, is that part of the picture in persons with autogynephilic sexual orientation?
And I have to speak tentatively because I don't have hard data on this. So all I'm speaking from here is my working knowledge of the types of folks we see at our clinic, and are there personality presentations that seem to be overrepresented there? And I would say yes. Be careful to say that I don't think that personality issues are in any way inherent to autogynephilia, but I do think that there are features about autogynephilia that can make the development of personality issues more likely. I think one pathway is related to what I just said in the previous question. Because there's a high rate of autism amongst our autogynephilic clients, and because we know that autism seems to be related to the development of certain types of personality difficulties, including cluster B, the kind of chaotic and dramatic personality features like borderline personality disorder, characterized by a diffuse sense of self, strong shifting emotions, fear of abandonment, self-mutilation and self-harm, and narcissistic personality disorder. We do see, I think, as a result of autism, higher rates of these types of personality manifestations. Now, separate to that is that autogynephilia is, for many people, an extremely shameful experience. And it's an experience that is hidden and can't be mirrored or destigmatized by others. And as a result, many of our clients, are fragile to the possibility of that shame being revealed. They might develop ways of compensating for feeling defective and shameful, and that might be compensatory strategies, overachievement, holding really positive and rigid views of the self, grandiosity. These are ways that people deal with strong and persistent shame, and I think that that can be one pathway to personality difficulties of that cluster B type, including narcissistic personality traits. And now, for those who are listening, Anne has published a really important paper, Narcissistic Shame in Autogynephilic Transsexuals, and I think it speaks beautifully to that particular pathway from shame to narcissistic traits in some AGP folk.
I discussed in that paper the views of the self-psychologist Heinz Kohut. He's talked about how when aspects of personality are seen as shameful, they can't be mirrored, that those experiences predispose to a sort of compensatory narcissistic style. One feels grandiose and entitled, perhaps, as a response to overwhelming feelings of shame. Uh, that makes sense to me. But as you pointed out earlier, we don't have solid data at this point looking at how prevalent personality disorders or dysfunctional personality styles, if I can say it, coexist with autogynephilia, or indeed with any kind of gender dysphoria. So that remains an open question, but it sounds like you're saying that clinicians need to be alert to that possibility. Access to considerations, and especially attention to cluster B.
That's right. And I just would like to jump in quickly because there's a common misunderstanding that autogynephilia might be caused by narcissism. So people say, well, this person had such a self-focused, grandiose view of themselves that their erotic interests became primarily focused on the self. Now, that is a lay conception which exists out there and which is sometimes used to paint autogynephilic people in an unfavorable light. But there's no evidence that there's any way in which the personality organization can influence the sexual orientation. It seems that the sexual orientation comes first, and the sex, that is, we said before that like most male sexual orientations, autogynephilia is thought to be innate and immutable. But this type of sexual orientation can lead to great shame, and that would be the pathway via which someone might develop those cluster B traits, including narcissism.
Uh-huh. Perhaps we'll be able to share more about that in a subsequent video if we end up making one. I'd like to turn to another question now. If you conclude that a client experiences an autogynephilic sexual orientation, are you inclined to share this with the client? And if so, what kind of explanatory language do you use? How do you present it?
Yeah. I always want there to be a formulation-driven reason for disclosing this information. And I don't think that it is appropriate to be disclosed to all patients. You want to have a good reason to do this. For some patients, they have found a way of making sense of their autogynephilic arousal, which they are satisfied with, which allows them to feel justified in the medical transition, and for which they are not overly ambivalent or tortured by, in which case I would tend to leave that alone unless that way of making sense of their feelings was causing them distress. A common way might be something like, well, cisgender women often get turned on when they wear sexy clothes. The fact that I've been turned on throughout my life from imagining myself a woman is perhaps just because of the same sort of mechanism that leads cisgender women to feel turned on.
Mhm.
I'll leave that alone. There are situations, sorry, yeah,
That's okay. It's important
yeah,
to think about how clients see themselves, how they explain these phenomena to themselves.
yeah.
Uh, Related issue, how do you talk about autogynephilia with parents? What do
Mm,
you say to them, and how do they respond?
okay. Um, I might say with both parents and with clients who come in, um, they might be ambivalent about whether they're experiencing transgender related feelings or whether they have a fetish.
Mm,
And this kind of false dichotomy, I think, can cause a lot of distress to the person or to their loved ones. And so it's situations like that where I would be, again, upon careful consideration, likely to introduce this concept of autogynephilia, to suggest that sexual feelings of arousal associated with having a woman's body, including erotic cross-dressing, are typical of the trajectory of most trans women. And I would introduce that as a way of undercutting the shame and normalizing the experiences. And I think that would be, my experience is that can be beneficial for the clients. Now, focusing on parents and the language I would use, I would frame autogynephilia, and I do frame it as a sexual orientation. So I might say, you might be aware of trans girls like Jazz Jennings from TV, who are really, really, really feminine from day dot, and everyone knows that kid is going to be trans or at least a very different type of boy. But your child is very different from that. And you are correct in identifying that. Your child is not like Jazz Jennings, but they are like the majority of clients that we see who go on to transition. And they have a very different pathway to being trans, but it's no less valid. And this pathway to being trans involves a type of sexual orientation that a lot of people don't know about. Now, before I use the word to describe this sexual orientation, I want you to know that this term now has entered kind of the popular vernacular with a bit of a negative tone to it. It's often used to undermine or trivialize the feelings of trans women. The term is autogynephilia, and it basically involves a birth assigned male who has a sexual orientation that makes them attracted to girls, including romantically attracted, but they're also attracted to the idea of being a girl. And that these recurrent fantasies of being a girl and the strong positive feelings associated with them can lead to, over time, the development of a feminine identity and gender dysphoria. And this type of gender dysphoria looks different to the early onset type because it doesn't come from having a pervasively feminine temperament that's evident from day dot. These trans girls typically look like fairly gender conforming typical boys. They have typical cognitive profiles and temperaments of boys, but these feelings that are very strong and pervasive lead to the development of a particular type of gender dysphoria, and that's what your child has.
So, to summarize, it sounds like you are careful to emphasize that autogynephilia is a sexual orientation. It is immutable. It's something that's going to be there for the life of the individual. And it sounds like you also believe that it's helpful to explain how autogynephilia develops in some detail. Useful
Yes, and
information for
I do want
clinicians.
to, in summarizing, you brought up something that I feel I should emphasize to those listening, which is um, because autogynephilia is a sexual orientation and therefore stable, the way that I pose the dilemma to the parents is we can't wish away these feelings. Like all sexual orientations, your child is going to struggle with these desires. And to the extent that there is choice in the matter, the choice is how one best accommodates these feelings in one's life. Whether one is able to get by living as a cisgender person who privately has autogynephilic feelings and perhaps might cross-dress, but is able to live a comfortable life in that way, or whether this person's desire to be feminine in body or social role is too strong for that, and that needs to be integrated into their public persona to some degree. And there itself, that can exist in a continuum from, wearing feminine clothing publicly through to wanting to feminize one's body with hormones through to full genital reassignment surgery and feminizing hormone treatments. And so I will say to parents that autogynephilia isn't deterministic of a trans outcome or full medical transition, but it can lead along that path. And that
Mhm.
many of the clients who are coming into clinic now, the majority do wish to pursue a hormonal treatment at least, and they tend to do quite well with that treatment.
So again, this is a very complicated set of issues that you have to discuss with parents. We have only a few minutes left, but I
Mm.
want to touch on two other questions that might be important to clinicians. If clinicians want to learn more about this phenomenon, what educational resources would you recommend to them?
Certainly. Unfortunately, at present, there aren't resources like courses of professional development on this topic. The best repository of information on this topic is actually your website, Anne, and I would like to give a shout out to that and actually show people the website. And this is
This
annelawrence.com.
is shameless self-promotion. I'm going to engage in it.
But
That's my
hugely
website.
beneficial, I think, to clinicians and others who might be watching this. So this is the website, and on the website is a link also to Anne's book, which is an amazing piece of work. Ray Blanchard describes it as the magisterial work on autogynephilic transsexualism, and it is. It's 200 pages reflecting 200 narratives of trans women collected by Anne, and this would be a great place for clinicians who are wishing to invest time to really understand this phenomenon in depth. For those who don't have the time at present to take a deep dive into Anne's work, I would suggest there is a 1,500-word essay on your website, Anne. Becoming What We Love is the title, and it's can be read in 10 minutes, and that would be a great way to get a solid feel for the concept. And so I believe What's New would be the tab.
A place to find it, yes.
There it is, Becoming What We Love, Autogynephilic Sexual Orientation, 2023. Anne also has her articles on the website, including the extended article published in 2007, Becoming What We Love, Autogynephilic Transsexualism, Conceptualizing the Expression of Romantic Love. And there are some videos and podcasts that you could watch. A seminar with Anne and some other experts in the area, Dr. Kevin Sue, and others, and
James, I have to stop you. I'm becoming embarrassed here.
Sorry, I will stop sharing then.
I have a final question for you. We're almost out
Yes,
of time.
yes.
What consultation resources are available to clinicians who believe they are seeing a client who might have an autogynephilic sexual orientation? Who can they talk to about these issues? Where can they find consultation resources?
Okay, so I provide consultation through my clinic, King Street Psychology Clinic. People can reach me through the website of the clinic or the reception email, reception@kingstreetpsychology.com. We have 17 clinicians here, all of whom work with this phenomenon, and a number of whom would be open to providing support for clinicians wanting more information about autogynephilia. And you yourself don't see clients anymore, but you do provide expert consultation for clinicians and researchers. Is that correct?
I'm willing to do that in selected
Yeah.
cases, but don't turn to me first. Turn to James and his colleagues first. They have much more recent information and they have much more expertise in the issues of children and adolescents. So, use me as the last resort. Talk to James. He has the current information. And I'm afraid we're going to have to stop there. We're out of time. But thank you, James, for talking with us today about these important issues. And I'm sure that what you've told us will be very valuable to clinicians who see clients with gender dysphoria and gender identity issues.
Thank you, Anne, and thank you for your important work in this area. I wouldn't have incorporated these ideas into my clinical work had your work not existed. So thank you so much for providing the clinical work which enabled these ideas to be accessible by clinicians like me. Thank you so much.
Okay, we have to end now. Thank you to all of you. Thank you to those of you who have listened to us, and good night to all.
Thanks very much. See you all.